Today we're talking about concussions, but probably not in the way you're used to. We're going to look at a huge shift in how we think about them, moving away from a one-size-fits-all approach to something way more personal and, honestly, way more effective. So let's just kick things off with a pretty big question. For years, the advice for a concussion has been incredibly simple. But what if that simplicity is actually the thing that's been holding people back from getting better?
To really get where concussion treatment is headed, we have to look at where it's been. So let's start by kind of tearing down that old, outdated myth.
Yeah, the old playbook was basically this. Get a concussion, go lie down in a dark room, avoid everything, and just wait. It was treated like this single, uniform injury. But the thing is, a concussion isn't just one thing. It's an incredibly complex and really individual injury. And this quote right here, it just nails the problem. Treating every concussion the exact same way is almost guaranteed to not work for a lot of people. I mean, it makes sense, right? The injuries show up differently, so the treatment should be different too. We needed a much better model. And that brings us to the solution, this new model called clinical trajectories. This is where concussion care gets a whole lot smarter and a whole lot more specific. So what is a clinical trajectory? Well, think of it like a category or a subtype of a concussion. It's all based on the main symptoms a person is having. So instead of a doctor just saying, yep, you have a concussion, they can now pinpoint the actual system in your body that's causing the trouble, whether it's your vision, your balance, or even your mood. You know, this analogy is perfect. Imagine taking your car to a mechanic who only owns one wrench. You wouldn't do it. You want someone who can figure out if it's the brakes, the engine, or the electrical system, and then use the exact right tool for that specific job. That is exactly what this new approach does for the brain. Okay, so this brings us to the real heart of it all, the 6 distinct clinical trajectories. Each one points to a different main reason for the symptoms someone's feeling. Let's break them down, one by one. First up, we've got the cognitive/fatigue trajectory. This is for the person who feels like their brain is a phone battery that just won't hold a charge. The dead giveaway here is that the symptoms, especially things like headaches and just pure exhaustion, get worse and worse the more you use your brain during the day. And this quote just says it all, doesn't it? It's not about feeling terrible all the time. It's this steady decline. The normal mental effort of a day at work or school suddenly feels like running a marathon you didn't train for. Next is the vestibular trajectory. This one is all about your sense of balance and motion. Your inner ear system, which is what tells your brain where your head is in space, gets all out of whack. And that's what causes the dizziness, the fogginess, and that totally overwhelming feeling you might get in a busy place like a grocery store. Yeah, this really captures that feeling of just complete sensory overload. It's like your brain loses its ability to filter all the noise and movement, and you're just left feeling completely lost and disoriented. All right, number 3 is the ocular motor trajectory. And this one is all about your eyes. Well, more specifically, it's about how your brain coordinates your eye movements for things like reading a book or even just looking at a computer screen. When that system gets injured, that's when you get that classic pressure behind the eyes feeling and headaches that pop up whenever you try to focus on something.
And that quote, man, it's so simple, but it's such a powerful way to describe that daily struggle when the connection between your eyes and your brain just isn't working right. So our 4th trajectory is the post-traumatic migraine. And let's be clear, this is not just a bad headache. We are talking about a full-blown neurological event. It's often this severe, throbbing pain, plus nausea, and this extreme sensitivity to light and sound that makes you just want to hide from the world. And that's the key difference right there. People with this trajectory aren't just feeling uncomfortable. They are often completely knocked out of commission by these episodes. Number 5 is the anxiety/mood trajectory. You know, a brain injury can really mess with your brain's chemistry and how it regulates emotions. This can lead to brand new feelings of anxiety or make existing ones way, way worse. You might feel constantly on edge, or you can't stop worrying about your symptoms, and then you can't sleep because your mind is just racing. This quote really gets to the vicious cycle at the heart of this trajectory. The worry itself becomes a major symptom, and that just feeds into the brain fog, the fatigue, and that feeling of hopelessness. And finally, number 6, we have the cervical trajectory. Sometimes, the same impact that causes the concussion also causes a whiplash injury to the neck. And in those cases, the neck itself, the muscles, the spine, can actually be the main thing causing the symptoms, especially those nagging headaches. So, here's the bottom line. It's all about understanding the why behind the symptom. Just look at this comparison. Someone with a cognitive headache
they need to manage their mental energy. But someone with a cervical headache, they might need physical therapy on their neck. Giving them both the same advice to just rest isn't going to be very effective for either of them. And that is why figuring out the right trajectory is such a game changer.
Which brings us to the best part, the payoff. Once you know the specific trajectory, you can roll out a specific, targeted treatment plan that actually gets to the root cause of the problem.
So let's take a look at what a targeted plan actually looks like. For the anxiety/mood trajectory, for example, the approach is active, not passive. It's about controlled physical exercise and getting on a regular schedule for sleep and food, all to help calm down the nervous system. See how specific that is? It's totally different from the treatment for, say, an ocular motor issue, which would need vision therapy, or the cervical one, which needs hands-on therapy for the neck. The key isn't just having a plan, it's having the right plan.
So what this all really boils down to is a move away from using a sledgehammer to fix every problem, and instead picking up a set of precision tools. It's about creating a personalized path to recovery for every single person.
You know, this new way of looking at concussions, it really opens up a fascinating question. We're seeing that by breaking down a complex injury into its different parts and treating each one specifically, we get better and faster results. It really makes you wonder, what other complicated medical issues are we still treating with that old one-size-fits-all approach, just waiting for this kind of personalized revolution?